Dear student, good morning. Today I like to highlight what are the childhood malignancy. You should know what are the childhood malignancy. You should know childhood malignancy. You should know name of the childhood malignancy. Leukemia, lymphoma. Leukemia, lymphoma. Then neuroblastoma, retinoblastoma, nephroblastoma, hepatoma, sarcoma, then osteosarcoma, then histiocytosis syndrome. You look to your book, everything in your book. Today I like to highlight leukemia. What is leukemia? Leukemia is very much commonest childhood malignancy in human being. Remember this one. Now what the definition of the leukemia? Leukemia means malignant clonal proliferation of the hematopoietic precursor cell and replace the normal bone marrow by the immature cell and infiltration to the lymph node, spleen, liver and other organs of the bodies. Now what are the types of the leukemia? There are several types of the leukemia, leukemia. You see your box. First of all, there is a acute myeloid leukemia, acute lymphoblastic leukemia, acute myeloid leukemia, chronic myeloid leukemia, then congenital leukemia. Remember this. There are four varieties. Four varieties leukemia. Most important one is acute lymphoblastic leukemia. You remember this. And second, it is about 75%. Next one is acute myeloid leukemia. It is only 20%. Then chronic myeloid leukemia only 3%. Look to your book, not to me. Load your book, not to me. Next, now I like to say about the acute lymphoblastic leukemia. How it classified? Classification done. First will be a morphological classification. The morphological classification means L1, a small cell with scanty cytoplasm. Then L2, larger cell and big cytoplasm. Next, L3 is big cell with baculation. Remember this one. This is the morphological classification. Number 2 is immunological classification. Immunological classification. Not previous cell, B cell and T cell leukemia. Remember this. Now this is the whole about. Now what are the clinical manifestation? What are the clinical manifestation of the leukemia? It's some systemic symptom like malaise, headache, fever, then symptom due to bone marrow failure, due to RBC failure there is a failure, due to WSU failure there is an infection, fever, then due to the thrombocytopenia, platelet failure, the thrombocytopenia, the bleeding manifestation. Remember this. And also there is the bony tenderness. Remember the bony tenderness. This is the clinical manifestation. Now what are the investigation? Investigation is, first of all you do some baseline investigation, CBC with peripheral blood film, and next you go for then go bone marrow study. After bone marrow study, then go cytogenicity, then cytochemistry, cytogenicity, then immunophenotyping. Remember this one. There are several types of investigation. Number one, that is complete blood count with peripheral blood film. Then study of the bone marrow. Then immunophenotyping, immunogenicity, then cytochemistry. This is called cytochemistry. Now first of all, what are the findings of the PBF in the peripheral blood PBF? What is the finding of the complete blood count? Complete blood count WS will be increased or decreased. Then hemoglobin will be decreased. Next there will be peripheral blood film. What happened in the peripheral blood film? Peripheral blood in this there is abundant, there is numerous blood cell and errors. Errors will be found in the peripheral blood. Remember this. Next come bone marrow study. Bone marrow is sharp. First type bone marrow you see the cellularity. Cellularity will be increased. Then myeloid electrolyte ratio will be increased. Then erythropoiesis is depressed. Megakaryocyte is depressed. But granulopoiesis is increased. Remember this one. Next go for Immunophenotyping. Immunophenotyping means immunological cell, VB cell, T cell, B cell, CD, CD3, CD7, CD13, CD14, CD17 cell. This is immunophenotyping. Then cytogenicity. Cytogenicity means karyotyping. Karyotyping to see there is any chromosomal abnormality like Philadelphia chromosome. Philadelphia chromosome present or not, you should remember this one. Philadelphia chromosome present is a cytogenicity. Then another one is cytochemistry. Cytochemistry, you look, which are not is present, you look at right in your book. Cytochemistry means to differentiate between the acute lymphoblastic leukemia or acute myeloid leukemia by cytochemistry. In myeloperoxidase and Sudan black B positive in acute myeloid leukemia, but in acute lymphoblastic leukemia there is what will be present? What will be important? Only acid phosphatase. Acid phosphatase is positive in acute lymphoblastic leukemia. Remember this one. This is the investigation. Remember this. And now what are the treatment? Treatment is two types of treatment. One is supportive treatment. Another is protocol-based multi-agent chemotherapy. Number 3, if medical treatment is failed, then we go for bone marrow transplantation. Remember this one. First of all, you see there will be supportive treatment. That is correction of the dehydration by fluid. Correction of the dehydration. Correction of the coagulopathy by fluid transfusion or flat fusion plasma supplementation, coagulopathy. Then correction of the anemia by blood transfusion. Then correction of the dehydration. Then neutropenic diet. You should give a neutropenic diet. Neutropenic diet means is low molecular, low microbial diet. This one neutropenic diet. You should remember this one. This is the supportive treatment. And there will also maintain the personal hygiene like oral mouthwash, acraflavin, hip bath, and all the physiological orifice will be sterile. Remember this one. This is the supportive treatment. Now you should give the specific treatment. A specific treatment is protocol based. Multi-agent chemotherapy. What is the protocol? In acute lymphoblastic leukemia, the protocol name is ALL UK ALL 2003 protocol. Name to the protocol name UK ALL 2003 protocol. This protocol you should given the drug should be given triple therapy, intrathecal triple therapy, that is hydrocortisone, methotrexate, cytarabine, then vincristine, L-asparginase, and prednisolone. This is the protocol-based multi-agent chemotherapy. If protocol-based multi-agent chemotherapy is failed due to recurrence or relapse, then we go for allogeneic bone marrow transplantation. Remember this. Go to your book. Look your book, not to me. Allogeneic bone marrow transplantation is the final treatment of the leukemia. Remember this. Now you should know what are the good prognostic criteria, what are the bad prognostic criteria. You should know what are the good prognostic criteria. Good prognosis is female child, first sex is female, is more than 1 year, less than 10 years, is leukocyte count is less than 50,000, no medicinal mass, no metastasis to the brain and testes, and hyperdiploidy. This is the good prognostic criteria. Now, what are the bad prognostic criteria? Bad prognostic criteria, sex will be male child and age less than 1 year, more than 10 years. If there is leukocyte count, initial leukocyte count is more than 50,000 per cubic millimeter, then there is medicinal mass and metastasis to the CNS, testicle, and Philadelphia chromosome present. This is the worst. This is the bad prognostic criteria. You should remember this one. Next, what are the oncologic emergency? You should know the question, like the question. What is oncogenic emergency? Oncogenic emergency means number 1, tumor lysis syndrome. Number 2, superior mediastinal syndrome. Number 3, superior vena cava syndrome. Then neutropenia. then infection, then bleeding. These are the oncology emergency room. What this, my dear student, this is all about. This is all about. Thank you very much for patient hearing. You should go through your books